One of the hospital groups involved here is the Philippine Hospital Association. And with us now, live via Zoom, is its president, Dr. Jaime Almora. Good morning, Dr. Almora. Thank you for joining us.
Good morning po. Good morning sa ating listeners.
Sir, what do we expect in today's meeting? A lot of parties have called on PhilHealth and hospital groups to settle their differences, especially since we're still in the middle of facing a global pandemic.
This is a follow-up of the last meeting. Yeah, there was a meeting last August 17, I guess, if I remember right. And this is a follow-up meeting. So we expect that there is a progress in their payment, and also the problem was the retroactive implementation of a circular where only confirmed cases is going to be paid, meaning the probable cases starting November 26 will not be paid, but the circular was issued in June. So malaki po yung hindi babayaran. And the House Committee on Health and Demographics last meeting in Congress made a resolution asking PhilHealth to amend their circular and to pay prospectively, not to deny payment retroactively.
So, sir, prior to today's meeting, or rather leading up to today's meeting, have you been able to talk to PhilHealth directly about this issue?
Yung tungkol sa PC Circular 2020-008 kasi yan, that is the retroactive application. Yun nga po, gumawa na ng resolution ang Congress at ito yung ipa-follow up lang nila itong araw na ito.
All right, sir. Now, for the circular that says that PhilHealth will not be or will be suspending payments to healthcare workers or establishments that are suspected of, some kind of abuse or unethical practices. What are your thoughts on this, and have you been able to speak to them about that?
Yes, this PhilHealth Circular 2020-0013, the temporary suspension of payment of claims, came at the worst possible time for the hospitals. The hospitals has been burdened since the start of this pandemic. Tuloy-tuloy po yan. We have been burdened financially, physically, and even our health workers have sacrificed their lives just to be able to manage and be of help in preventing the spread of this disease. So nagkaroon ng we have to expand our capability. We have to spend in repurposing the hospital. And then there came the order that we cannot charge co-payment. So financial burden yan. Tapos nagkaroon ng order nga na that we are going to not be paid for the probable cases. And then we had this mounting problem about manpower where we have to give additional salary to our nurses because of our dwindling supply, and there's that looming possibility that all the other health workers will be asking for an increase, and in fact they are doing it now. There is that circular again that basically they are removing the case rate for those. I mean, they are removing the efficiency gain from the all case rate policy, where if the actual expense is lower than the case rate, they're going to pay the lower amount only. The efficiency gain was designed to cover up for losses for the no balance billing. And here comes, after we have been suffering for so long, waiting for payment because payment of COVID claims are not being paid, then here comes this circular, temporary suspension of payment of claims. So this is a burden over another burden over another burden, and then finally, here comes the straw that will break the camel's back. So nagkaroon ng explosion yan. yung mga hospital nagalit. At yun nga, sabi nila kung ganun rin lang, hindi pala tayo mababayaran. Suspitsa pa lang, probable fraud pa lang, hindi pa napapatunayan, hindi na tayo babayaran. Mag-disengage na lang tayo. Yun ang initial response ng marami sa mga ospital na nagtumawag sa akin.
Right. And as you said, sir, over the weekend, PHA, the Philippine Medical Association, Private Hospitals Association of the Philippines, issued a statement announcing disengagement nga po from PhilHealth. Will you disengage from the state insurer?
Come again, hindi malinaw yung audio.
Sir, will you indeed disengage from from PhilHealth?
Disengagement will come as a natural consequence if a hospital will feel aggrieved of not being paid. Pag tinigil yung pagbayad sa isang hospital, that is a natural possibility because once there is a defined case that is probable fraud and they stop paying, but they demand that the hospital keeps on admitting patients and extending credit. Remember, nagpapautang lang kami. Bakit ka pa magpapautang? Why will you extend credit if you are not going to be paid? So the natural tendency is not to extend credit. That is disengagement.
That's right, sir. Well, we certainly do hope that today's meeting is productive for everybody's sake. Thank you, Philippine Hospital Association President Dr. Jaime Almora.